All right, friends, I want to remind you that when you're shoveling snow, shoveling snow is a major part of heart attacks.
A doctor of internal medicine and pediatrics and about to shovel some snow, so let's hear what she has to say and talk about it.
So we push the snow and we do this. What we don't do with snow is we don't lift and scoop. This action is what actually causes the heart attacks. It is not when you get a pusher. So if you don't have a shovel like this one that just pushes the snow and stamps it, you are going to want to get one. But remember, as an adult, you cannot be doing this. This action is what causes heart problems. So please don't do that.
So is this true? I'll say yes and no. Let me explain. So it is true that shoveling snow has been associated with acute coronary syndrome, myocardial infarction, and sudden cardiac death. But it's important to know that it is not just the act of shoveling the snow that causes it. So oftentimes this will be on the background of someone that already has undiagnosed cardiac issues, meaning they could have some plaque in their coronary arteries. Maybe they have a lot of the risk factors that's already associated with acute coronary syndrome. And then unfortunately what happens is they go into the cold temperature and do a workout such as shoveling snow that their body is not used to. So the cold exposure while shoveling snow leads to increased cardiac workload and increased myocardial oxygen demand. Both of these on the background of someone that may have pre-existing cardiac issues can lead to myocardial infarctions or heart attacks. So no, it is not just the act of picking up the shovel and tossing the snow, and just pushing the snow may not alleviate this, but it is possible that pushing the snow does decrease the workload that someone's exerting, and then in turn may slightly decrease the risk of cardiac events. But it all depends on the person, their risk factors, and how fit they currently are. Someone that is not used to doing anything, even just pushing the snow, can be difficult for them and increase their cardiac demand, leading to cardiac events. So to hopefully prevent and reduce the risk of cardiac events, here are some tips. 1. Avoid unaccustomed, vigorous physical activity. 2. Exercise regularly. 3. If you're going to be working or playing in the cold, make sure to warm up beforehand. 4. Avoid extreme cold because again, this increases your myocardial demand. 5. If you're someone that has risk factors, make sure to do screening with your physician. Make sure to know the warning signs of acute coronary syndrome. Some examples could be chest pain, shortness of breath, and dizziness. So all in all, if you need to shovel snow this year, make sure to be safe. Know that whether you're pushing or lifting the snow, it all depends on your current fitness level and your risk factors for an acute coronary event. Stay safe out there during the winter storms that we're currently having.